us. We're going to wait another minute and then get us started. All right. Welcome, everyone. Thank you for joining us. My name is Roshanak Medipana, and I'm the director of the Housing Solutions for Health Equity Initiative, housed at the University of Michigan School of Public Health. Thank you for joining us for the Housing Solutions Speaker Series, where we highlight housing research and its connections to health and health equity. For those who are unfamiliar with what we do, the Housing Solutions for Health Equity Initiative informs local, state, and national policy through interdisciplinary research on housing as it relates to equity in health, race, socioeconomic status, and aging. As part of our work, we developed a pilot grant program to fund researchers who are interested in exploring housing and health-related topics. During this webinar, we will hear from our three grantees, Dr. Kate Bauer, Associate Professor of Nutritional Science, Dr. Margie Dewar, Professor Emerita of Urban and Regional Planning, and Dr. Joe Labriola, Research Assistant Professor at the Institute for Social Research, who will discuss their projects and findings with us today. Housing Solutions prioritizes engaging in research that addresses housing and health equity because we believe access to adequate housing is a human right. Before I introduce the speakers, I would also like to thank our staff working very hard behind the scenes today, Malika Belhaj, who has brought all of this together, and Kate Brantley assisting us today, ensuring all goes smoothly. Throughout the event, please feel free to submit your questions to the Zoom Q&A, and we hope to answer them during the Q&A session at the end. I encourage you to use your side-by-side speaker setting for Zoom to see and hear our speakers today. With that, I will introduce our first speaker, Dr. Kate Bauer. So, trained as a behavioral epidemiologist, Dr. Bauer's research focuses on understanding social, personal, and behavioral influences on children's healthy eating and weight, and translating these findings into innovative nutrition promotion and obesity prevention programs. She is particularly interested in identifying how diverse social contexts and public policies affect families' ability to engage in effective nutrition-related parenting. Today, Dr. Bauer will discuss her research project, Unpacking Eviction, Understanding the Effects of Eviction on Supplemental Nutrition Assistance Program Participation Among Michigan's Urban Families. Thank you, Dr. Bauer.
Thank you so much. Welcome, everyone. I'm really excited to share our findings. And I will. Okay. All right. So before I get started, of course, I want to acknowledge our team. I believe many of them are on the call. Tamara Grice, Teresa Mitchell, Janine Ali, and Carl Gershenson. Also, I want to acknowledge the Feeding My Family's Parent Leadership Boards. I'll talk in a minute about who those folks are. And of course, I want to acknowledge our funding sources, Housing Solutions for Health Equity, along with the Kellogg Foundation, who funded the parent work that contributed to all of this. So, to provide a bit of background, in summary, eviction is incredibly common. To be honest, more common than I ever realized. So, within Michigan in 2018, there was one eviction case for every 6 rental units. And specifically in Battle Creek and Detroit, eviction is even more common. And I highlight those locations because, as I'll discuss, that's where participants in the current city study are from. Um, for 20% of the families for whom an eviction case has been filed against them, these eviction filings lead to physical eviction. So this equals 5% of all renters are evicted and have to leave their home. And for many of these families, or for many families who have an eviction filed against them, it may not lead to physical eviction, but they end up leaving their homes anyway. Maybe they leave their homes before the eviction filing has resolved out of fear, concern, necessity. And so there's basically a lot of families within Michigan and nationwide leaving their homes and being forced to leave their homes due to costs. And there's increasing evidence that suggests that cost-driven moves, including eviction, most notably eviction, disrupts access to social safety net programs, including the Supplemental Nutrition Assistance Program, otherwise known as SNAP, commonly thought of as our food stamp program, which is our nation's largest food assistance program. So, research by my colleague Carl demonstrates the loss of access to SNAP among evicted households. So, as you can see, prior to the eviction event, both households are using SNAP is the bottom line. This is among households using SNAP. Um, and at the point of eviction, SNAP participation decreases precipitously. It decreases less so for those for whom an eviction was filed against them without the eventual eviction judgment, and it does seem to come back up to 5 years post filing. But for those with an eviction judgment, SNAP participation drops. There's about approximately a 7% decrease in SNAP participation, and it never recovers. So during a time period where families need resources the most and are clearly experiencing financial and um, other insecurities, they are losing access to benefits. So the question becomes, why is this happening? Why, in a time of most need, are families losing access to SNAP? I think there's sort of a simple answer, maybe the lowest hanging fruit answer, which is that, okay, people have moved. They're no longer receiving their mail. They can't get notices that they need to recertify for their benefits. But the more that we thought about this and wondered, we realized there's probably more to it, and that we must understand the social, physical, and administrative factors that create barriers to SNAP participation post-eviction. So that was the goal of this pilot work. So what we did, this was a qualitative study, and we conducted semi-structured interviews with 35 individuals from the Feeding My Families cohort. I'll take a second and describe who that is. So for the past 4 years, my team has been funded by the Kellogg Foundation to understand the lived experience of food insecurity among Michigan families. And so we have surveyed about 1,300 families from across the state, all of whom within the past year have experienced food insecurity. And so for this project, we selected 35 of those individuals. And the eligibility criteria for these interviews were that those parents who were in the Feeding My Families cohort had used SNAP at some point, and we knew that from our existing data, and also reported experiencing eviction. How we did this is, and how we identified this is that we sent our whole Feeding My Families data collection was via text message. So we were able to send a text message out to many of our families and ask them additional screening questions about whether they have ever been forced to leave their home, experienced eviction. We got a large number of participants who said yes. So the 35 is just a subsample of many, many eligible individuals within our cohort. I also want to emphasize these are not necessarily people who were evicted and then lost access to SNAP. That would be a very, very select subset among our cohort. But we felt that by talking to individuals who both have experienced eviction and have used SNAP during their adulthood, we would be able to understand the experience of those two events and gain insight into what might it be about eviction that is leading to the loss of SNAP. So within those, or among those 35 individuals, most were women. On average, they were in their late 30s. 67% were Black, 18% identified as white, and 15% Latino. And of these individuals, 14% were currently housing insecure. So that is another question that we asked originally in our Feeding My Families study. Specifically here, all of these individuals are from Detroit, Battle Creek, or Grand Rapids, which were our urban sites within the Feeding My Families cohort. We developed an interview guide, which was refined through feedback from our parent leadership board. So we have about 30 parents from across the state who have been our parent leaders on the Feeding My Families project and give us pretty straightforward feedback about, hey, your research questions don't make sense to us. And we improve them and we make sure that we're making sense and we're asking what we intend to ask. Our interviews were conducted via Zoom and audio recorded. Tamara Grice, one of our research assistants, conducted all of the interviews, and the participants received a $50 gift card. Once the data were collected and transcribed, our research team used a 6-phase framework for reflexive thematic analysis. And what we found is that the loss of SNAP benefits due to eviction, the things that contribute to that actually begin to occur far before the eviction experience. And there are consistent factors that occur and impact families starting from before eviction, through the eviction process, and then after the eviction. So I'm going to talk for a few minutes about what those things are. So before eviction, families spoke quite a bit, as you might imagine, about housing-related stress and chaos. Houses were not up to standards. They were not safe for children and families. There were disagreements with landlords. There was, right, a lot of things that precipitated the eviction that also, of course, affected the family and affected the parents' ability to sort of manage, the details of life. Related to that, we heard a lot about general life stress and chaos. We heard a lot about, women who were pregnant, who had high-risk pregnancies. There's just a lot going on in these families that you'll see as we walk through this really precipitates a loss of connection to social services. However, one of the major things that you will see throughout our findings is that there's an incredible amount of fear, mistreatment, cynicism, and lack of understanding of social services, bureaucracy, and legal systems. And that fear and that experience of mistreatment, which occurred, way before eviction, probably, perhaps since these individuals were children, and certainly as they were adults, absolutely affects relationships with social services and what happens during the eviction process. So let's talk about this. So factors that during eviction seem to affect connection to SNAP benefits, the timing and communication around the eviction process. There are laws about how much warning families should get, how things should be communicated. Those that often don't happen the way that they should. And families are really scared and rushed out of their homes in quite a hurry. And what we heard a lot is that in these situations, housing becomes a top priority. If we think about our fundamental needs, if you fear that your family will be homeless, finding a safe place for you and your children becomes the top priority. And other resources, which are really essential, become secondary, right? I just have to get my kids into a home and then I'll deal with everything else. Again, this is a time of incredible personal stress, chaos, and really weakened mental health. We heard a lot from families about depression, anxiety, and really just a lowered capacity to navigate all of the systems that they're needing to navigate during this time. There are logistic factors, right? It's difficult to maintain access to documents if you have to leave your home or you feel you have to leave your home within a week. Um, it's, that just a lot of things are left behind, are lost, are thrown away. We did hear a lot from families about the importance of existing connections to resources and social networks. And so, certainly, the families that had stronger connections through a church community, through extended family, had a much easier time during the eviction process, and therefore, we believe would have maintained their SNAP benefits more so. Relationship with MyBridge's caseworker. This goes right along with the level of fear, mistrust, and cynicism with bureaucracy. Those caseworkers, which can help you, stay enrolled in SNAP, get housing assistance, maintain connection to your health insurance, those relationships are critical. And if there's mistreatment or distrust within those relationships, oftentimes parents don't want to share that they have been evicted or they have been forced to leave their home. There is a pervasive belief that if a family is homeless, they will lose their children to Child Protective Services. And again, that's all through a history of mistreatment and fear, which is causing them to, be scared of sharing their circumstances and getting resources. Um, After eviction, many of these things continue. The things we talked about, obvious, like people don't have a consistent address, documents have been lost. A lot of families are doubling up, and there's really unclear um, rules about what constitutes a household, whose income matters when it comes to SNAP benefits. And we think that that is leading to the loss of benefits. We learned a lot about living in a shelter and restrictions on food. And if you can't bring food into your shelter, then why should you go through all the work of getting SNAP benefits? I'm not going to go through all of these, but you can see that there's a lot of challenges that occur post eviction that lead to, or we believe lead to, this loss of SNAP benefits. And again, there's threads running throughout: relationship with caseworkers, connections to resources, personal stress, chaos, and mental health. So, in conclusion, some of our recommendations: from the beginning, building trust within social service systems is essential for maintaining connection to services after eviction. We have to reduce the fear. We have to reduce the uncertainty that, will my child be safe? Should I report this? What happens if I report this? We also found there are a lot of logistics situations, right? Allow people to continue to get benefits and extend their certification for a period after eviction while they get their documents together, while they get their feet under them. There needs to be clarity and consistency in what counts as a household and who living together needs to be considered to get SNAP benefits. And that has to stop hurting families who are caring for each other and allowing people to stay with them. And finally, we really want to encourage food access and dignity and connection to assistance within food shelters. We were really surprised to hear how limited and how harsh shelters are around food and food access for individuals who are experiencing homelessness. Thank you very much.
Thank you so much, Dr. Bauer. Next, we have Dr. Labriola, whose research uses survey and administrative data to examine the roots of racial and socioeconomic inequalities in the contemporary United States. His current work primarily focuses on racial inequalities in housing and wealth. Dr. Labriola has also published on the causes of class gaps in parental investments in children and in exposure to precarious working conditions. Dr. Labriola will discuss his research project, Early Childhood Exposure to Residential Lead-Based Paint and Adult Economic and Criminal Justice Outcomes. Thank you.
Great. Thanks, Shannon, for the introduction. Thanks to everybody on the HSHE team for putting this event together. It's really a pleasure to have the opportunity to talk about this project that's been supported by an HSHE pilot grant. There we go. So I'll start by kind of outlining kind of the goals that this project has. And there are three kind of goals as I see it. One is to generate causal estimates of the relationship between early childhood exposure to residential sources of lead and various adult economic and criminal justice outcomes. As I'll talk about a little bit later, we know a lot less about kind of the long-term effects of early childhood lead exposure relative to the short-term effects. And second, the goal is to use these estimates to estimate the contribution of early childhood lead exposure to racial and socioeconomic gaps in adult economic and criminal justice outcomes. As I'll also talk about, there are really stark inequalities by race and parental socioeconomic status in early childhood lead exposure. And so there's good reason to think that these two things might be causally linked. And the third is to make kind of a data improvement on previous geospatial approaches for modeling lead exposure across the United States. So a lot of the existing geospatial measures of lead exposure are at the census block or the census tract, or I mean census block group, excuse me. And in this project, I'm trying to see the utility of creating measures that are available at the household level. So getting a more specific measure of residential lead exposure. Um, so lead is very bad for children. It's a dangerous neurotoxin. It affects brain development, interferes with all sorts of systems within the human body that are just essential for daily functioning. Um, Lead exposure is most consequential for young children for a few reasons. One is because children put their hands in their mouth a lot, so they're likely to inhale or ingest lead dust that is present in the house. Two is that they absorb lead more efficiently than adults do, and three is that because lead is really bad for brain development, early childhood is a very crucial period for brain development, and so it's most harmful to have lead exposure during kind of these sensitive early years. So there's three sources of residential lead exposure I'd like to highlight today. One is lead-based paint, which is common in older deteriorating homes. There were first regulations in the 1950s on the lead content of indoor paint, and lead was banned in almost all residential paint in the late 1970s. But in older homes that still have older paint, where it hasn't been fully removed, sometimes if the paint has chipped off, then children can put that in their mouth, or the paint has turned into dust and children can inhale that. The second is leaded water pipes. As we all know, being in Michigan, this is a real issue. The risk of lead being in the water. Estimates that lead water pipes still service up to 13 million homes in the United States today. And the third source is lead that's in soil that is either on the outside of house or that's brought into house from walking in or from the soil blowing into the house through wind. And this lead in soil has mostly come from leaded gasoline deposits near roadways, from roads that were well trafficked before the US phased out leaded gasoline in the 80s and 90s. So I really like this figure. It's from a recent article in Demography, and this is looking at neighborhoods in the city of Chicago. And you see on the left, you see measures of concentrated disadvantage, where the darker areas indicate greater levels of disadvantage. And on the right, you see measures of elevated blood lead prevalence from testing that the city of Chicago does on young children. And you can see very, very strong correlations between these two maps. The areas that are most disadvantaged also are the areas where children are at the highest risk of blood lead prevalence. And given the overlap between income and racial segregation in the United States, and especially particularly in the city of Chicago, this means that not just poor children, but non-white children are much higher risk of lead exposure in the homes that they live in. So we know that early childhood lead exposure leads to worse school performance, higher rates of ADHD, more delinquent behavior, things like dropping out of school, getting suspended from school, worse cognitive scores as adults. And there has been some research that's looked um, at racial and socioeconomic differences in early childhood lead exposure and how that affects early childhood outcomes. So a couple of recent studies have shown that these differences help to explain gaps in young children's performance in school. But what we don't know quite as much about is how these differences affect racial and socioeconomic gaps in adult outcomes. And one of the main issues is just that it's difficult to have data that tracks early childhood lead exposure at home and is able to model that in a convincing way. That also tracks the children all the way through adulthood and is able to track their outcomes in adulthood. So what I'm proposing to do is to make use of the data that's available at the Federal Statistical Research Data Center. These are secure facilities that provide access to restricted use microdata for statistical purposes. There's one available in the basement here, the Institute for Social Research at the University of Michigan. So for a lot of the data sets that are available in the center, census researchers have assigned individuals a protected identification keys that are allow you to link individuals across different data sets. And the, the Census Bureau has also compiled this data set of a yearly home address file for each individual um, in the data. So you're able to track for individuals that have these keys, you're able to track where they've lived every year since 2002. So the sampling frame is taking advantage of children who are captured in the census or American community surveys between 2000 and 2010, for whom I can identify their home address in all years since birth. Um, I plan to use a few different proxies of residential lead exposure. So for lead-based paint, I plan to use data from a CoreLogic tax history data set, which has information about the structural characteristics of nearly all residential addresses in the United States. So things like the year the home was built, which is very strongly correlated with lead exposure due to the presence of leaded paint. The type of home, whether the home is deteriorating or not, things like that. Um, so second, for leaded pipes, hopefully I've been in contact with Stuart Battleman over at Public Health, and he was letting me know that hopefully forthcoming. It's hard to say anything for sure now, but there should be federal data coming out soon on U.S. addresses that get water from lead pipes, which I'll be able to use to measure leaded pipe exposure. And then leaded in soil, basically the idea that I'm planning to do is to geocode the address proximity to highways and roads and use that to model the amount of leaded gasoline exhaust that gets deposited in soil as a result of historical traffic in the region. So one step of this project will be to basically see how well these proxies actually measure lead exposure. And for that, we need data that has both information on address and on measures of lead exposure. So the NHANES data is really well suited for this task. It has information on both floor and window lead test data collected from a nationally representative sample from 1999 to 2004. And it also has address data, so the latitude and longitude. So I'll be able to hopefully link individuals living in these households to the information about the types of homes they're living in, how close they are to traffic, and try to see how well we will be able to predict lead exposure from lead dust from proxies of lead-based paint and lead in soil. And then the next step will be to predict the lead biomarkers among the young children in the data from the predicted lead dust levels, as well as from the presence of lead water pipes in the homes that they're living in. So the FSRDC also contains several other data sets for adult outcomes. These include employment and earnings from the longitudinal employer household dynamics data, information on educational trajectories from the American Community Survey, and information on criminal justice contact from the Criminal Justice Administrative Record System. So a lot of these data set cover a broad share of the United States population. So it really allows you to kind of harness the power of very large sample sizes in understanding these effects. Um, so briefly, kind of the research plans to identify these causal effects using some exogenous variation in lead exposure. To look at the effects of residential lead-based paint, I plan to use state-level variation in lead-based paint abatement policies. To look at the effects of soil that's been contaminated with lead, I plan to use the variation in decline in lead in soil by the residential distance to traffic. So basically, the idea here is that soil near roadways will have had more lead before the phase out of leaded gasoline. So kind of over time, as the wind blows lead around and the soil content and lead gets reduced, this reduction is faster in areas that were closest to traffic. So briefly, the HSHE pilot grant has supported me in kind of elaborating this research plan more fully and constructing some larger grant proposals to support this research. So currently, I'm working on proposals to access this restricted use data and an R21 grant proposal to validate the method to measure household level lead exposure from this kind of external national data. And in the future, I'm hoping to submit an R01 proposal to carry out the full project. So thanks to all of you for listening, and thanks to HSHE again for supporting the project.
Thank you so much. And next we have Dr. Dewar, who's a professor emerita of urban and regional planning and a special advisor with the Poverty Solutions. Her research analyzes how planners can address issues facing cities that have experienced substantial population and employment loss. She studies remaking cities following abandonment, strengthening deteriorated neighborhoods, and reducing the harm residents experience from disinvestment in the city. Her work draws on Detroit's experience to illuminate broader issues of improving quality of life in cities that have much smaller populations. She's investigating how residents and community-based organizations succeed in saving some neighborhoods from disinvestment, how vacant land gets reused productively in a weak market, and how home ownership by very low-income households might stabilize their housing and preserve structures. She's continuing to work with others on ways to prevent evictions and to decrease tax foreclosure. Today, Dr. Dewar will discuss her research project, Assessing Good Cause Eviction Regulation by examining eviction practices among low-income housing tax credit and comparable rental properties in Detroit, Michigan. Thank you.
Hey, I thank you, Roshanic, for that introduction, and I hope you can all see my presentation okay. I am doing this research on evictions in the buildings that have been financed with low-income housing tax credits. LIHTC, I'm going to use that term throughout, in Detroit. That's federal funding that finances affordable housing. My colleagues in this project are Eric Seymour at Rutgers and Alexa Eisenberg in the School of Public Health here. So what? Why does this matter? Kate Bauer really laid out a lot of the issues I was going to mention. The evictions are very high in the US in general. 1 in 9 rental households is threatened with eviction, meaning an eviction a lawsuit is filed against them in any given year. And many households, as Kate said, who receive these move, or sometimes they are actually physically removed from their house. Sometimes they manage to pay their rent and defer eviction. A growing body of research, as Kate also mentioned, shows that evictions and eviction filings, the lawsuits, lead to loss of jobs, worse health. They cause households to live in higher crime neighborhoods and in housing with major problems like no heat. They cause children to fall behind in school because of frequent changes in school. And even if an eviction filing does not lead to an eviction, it provides a record that other landlords can access and makes it a lot harder for households to find other housing. LIHTC housing is the largest source of subsidized housing, affordable housing in the US. So it's especially important to understand what's going on in those houses. Federally subsidized regulated housing of any type faces a different kind of requirement for evictions, which is there has to be a reason, such as non-payment of rent, hazards and injuries to the property and to other tenants. So that means that we'd expect LIHTC evictions to be fewer than in non-market housing, or in market rate housing rather. So we asked, what are the eviction filing rates in LIHTC housing versus comparable market rate housing? Are the tenants protected by this just cause regulation, and what accounts for the eviction filing rates we see in LIHTC? So elsewhere in the country, the findings are all over the place. Sometimes they show more LIHTC units lead to more eviction filings and more evictions themselves. Sometimes they show the eviction filings and evictions are about the same as those in market rate housing. Sometimes they show there's a negative relationship between more LIHTC housing and eviction filings. So we thought we'd like to find out more and decided to look at Detroit's situation. Detroit has a weaker housing market than any of those studied so far. And so the poverty rate's very high. The city has lost population for many years, which means there's very weak demand for housing. Tenants face very high housing cost burdens, even though Detroit's housing isn't high priced compared to most other cities in the nation. Responsible landlords have difficulty covering their operating costs and repair costs, and they risk costly vacancy if they increase their rents. So we expect Detroit's eviction filing rate to be very high, and it was in the years leading up to the COVID period. The eviction filing rate was 22%, which means as Kate also said, Kate Bauer, 1 in 5 rental households face a threat of eviction in any given year. This compares to other cities, much higher than most, though in Atlanta, eviction filings are even higher. So our research design is to look at all the multifamily houses or projects that the state is currently monitoring that were developed using LIHTC. And that turns out to be 170 projects, separate projects. And then we wanted a comparison group of similar multifamily properties, which meant we wanted them to be in census tracts with about the same housing market, or with housing markets that would serve the same population as LIHTC projects, which means that the median household income in those census tracts is less than 60% of the area median income. Area median income is determined across the 3 counties, Wayne, Oakland, and Macomb County, and in each year, and often is referred to as AMI. So we also obtained eviction data for 2019 to 22 scraped from the 36th District Court by Data-Driven Detroit and my colleague Alexa Eisenberg with Josh Akers, so about 80,000 eviction filings. And then we matched these filings to these properties by addresses, which took hundreds of lines of Python code and turned out to be a more Herculean data project than I had expected. So I should have thought of that. And you'll notice this covers the COVID era when major forces affected evictions. First, there was a moratorium on evictions, and then the stipend assistance and rental payments that reduced the numbers of evictions in that period. But we still thought we could tell what the relationship was between the LIHTC multifamily projects and the comparison multifamily properties, even so. So this is what the geography looks like. You'll see the LIHTC properties in orange are in a very different area than the blue comparison properties. That's because this area with downtown here and midtown here is what real estate folks call hot. And that means the rents of other properties in that area, they're serving a different market than the LIHTC properties are allowed to. So, but at the same time, they are similar types of units. They are similar. They have a range of types of properties in both cases. And it's been interesting to see across the city what they look like. So what have we found so far? Well, the LIHTC properties do have consistently lower eviction filing rates than the comparison ones, but the LIHTC properties in orange have about the same overall eviction rates as the city wide eviction rate, so about 22% in 2019. And then you see the decrease due to the COVID restrictions. The comparison properties, however, have a lot higher eviction rates. They're above 30% in 2019. Looking at, so it turns out that landlords may well be filing what are called serial evictions, which means the same person, the same household has a second lawsuit filed against them within a year. LIHTC properties have lower non-serial eviction filing rates, but they're still 15% in 2019. And the comparison properties are right up there around 23, 24%. So even though, so it means the numbers of households affected by these filing rates is lower than expected from just looking at the number of eviction filings per 100 units total. It's still a lot of households being hit. So are the LIHTC evictions adhering to just cause eviction requirements? Well, they are adhering to that in larger proportion than the comparison properties. The darker blue shows the percent of eviction filings due to non-payment of rent, which is a legitimate reason for filing for eviction in just cause cases. The turquoise, however, the turquoise may well include hazardous and injury to fellow tenants behaviors. So those are at least partially just cause. The termination of tenancy, there's more doubt because that really means that the landlord may have just decided they want to not renew the lease or want to terminate the lease to provide the housing for a friend. So we know that the cases, however, are adhering to just cause. So we want to unpack more of what's happening within LIHTC. And what we found, looking at elderly housing versus all others, which are mainly family housing, is seniors are evicted, receive eviction filings at a lower rate, but among the other households, the rate is 25%, was 25% in 2019, very high. So are these eviction filings, well, the question then we were asking is, why can't renters pay for affordable LIHTC housing? And the reasons are that rent is determined in the unit, not the tenant's income. So a developer commits to providing a certain percent of units for specific rent level in relation to area median income. And so then if a tenant's income falls, and among households, incomes are often quite volatile, the tenant can't afford the same rent. So then they fall into the problem of not being able to pay. And also rents rise as area median income rises, which means if the suburbs grow incomes rise faster than the cities, then the rent rise is faster than the income rise in the city. And without an increase in income, the tenant can't afford it. But there's a solution in place, which are project-based vouchers, which are HUD provided to different projects. Not all the LIHTC projects, but they are, therefore should mean though, what they do is that that HUD pays the difference between 30% of a household's income and the 60% level, AMI level of rent. So it means that if families' incomes rise and fall, they can still pay rent without being housing cost burdened, if it all goes well. But what's striking to us here is that if we look at family LIHTC properties with project-based vouchers and without, the ones without face eviction rates that are getting quite close to our comparison properties' overall eviction rates, eviction filing rates, very high. And even with project-based vouchers, families are getting eviction filings at the rate of around 18%. So it's not solved. Project-based vouchers have not solved the eviction filing issue. And then we have two very puzzling results. One is, if we look at DHC, which is Detroit Housing Commission housing, meaning these are public housing projects that were partially financed by LIHTC. So they're in public housing, the tenants are charged 30% of their income for rent, and HUD and the Housing Commission and HUD pay the rest, or make up the rest of what would have been a rent potentially. So, but still 30% of households in public housing, which essentially have additional subsidy for their rents, received an eviction filing in 2019. So what is going on? And elsewhere in the nation, researchers have seen that public housing agencies often have very high serial filing rates, and we haven't been able to look at that yet. Among seniors, project-based vouchers properties have higher eviction filing rates than in properties without project-based vouchers. Why would that be? That we do not understand that either. And so we'll go on to look at that. So what does it look like on the owner's side? in a housing market like Detroit's, a lot of the property owners don't have sufficient cash flow to address their maintenance and repairs by the time the projects reach 15 to 20 years old. They projected a cash flow shown in the orange line that was a lot more optimistic. But in 2015, I, along with colleagues, found that 55% of the LIHTC projects, the older LIHTC projects in Detroit, were not able to cover their costs, so their annual costs. So therefore, that leads to stricter property management, more effort to keep vacancy down, but also insistence on paying rents, and could therefore lead to more eviction filings. So we have numerous next steps, which I will not go into, which is that we're going to look at outlier projects. We're going to look at the ownership nature. We're going to look at what do people think might be solutions to these challenges, and is just cause functioning the way it should? What would need to be happening to reduce these eviction filing rates, especially in the LIHTC properties? So thank you for your attention, and we're happy to have any of your comments and questions that'll help us advance it.
Thank you, Margie and Kate and Joe. So we have a couple of questions from the audience, and then I can open it up to more questions too. But Kate, a question came in, does the Michigan Department for Health and Human Services act upon reports of adults with children who are homeless? And what do those reports turn into, and are the children then put into foster care?
So officially, not having a home or being unhoused is not sufficient justification for determining neglect or abuse against a child. However, it's funny, I was also looking at the sort of policy handbook, and there are questions when child welfare caseworkers do assessments of, is this child having a, imminently, has this family had an eviction filed against them? Have they been evicted? Do they have a safe housing? So there are, it is explored when there's a case, and I don't know how often those, reports of neglect are substantiated and what the circumstances are. But I was actually thinking, Joe Ryan in social work has a lot of information about child welfare within Michigan, and that would be really interesting to understand sort of how often eviction is leading to family separation. So we can dive into that a bit more.
Thank you, Kate. And Joe, a question for you that came across was that given that communities experiencing higher levels of lead exposure are often also facing larger socioeconomic disinvestment and systemic inequities that you mentioned, this audience member was curious on how you plan to control for or account for these broader structural factors in your analyses, making the connection between lead exposure and economic and criminal justice outcomes. And one more technical question, how do you plan to isolate the specific impact of lead exposure while also considering these larger socioeconomic influences?
Yeah, that's a really good question, Rosaline. So the data will come from the Census or American Community Survey, the initial sample. So that'll allow me to kind of control for a wider range of kind of individual level or household level factors that the children at risk of lead exposure are facing, as well as, because of having the address file, also be able to control for kind of more neighborhood census tract level factors like neighborhood disadvantage, things like that. The kind of point about isolating the specific impact. So hopefully the idea is that I'm able to kind of isolate some sort of exogenous sources of lead exposure. So kind of thinking about the policy changes that require older homes, owners of older homes to do lead remediation and if they have older lead-based paint, then they have to, spend the money to remove it. Or kind of looking at, differences in the decline in leaded soil by proximity to roads. But it'll be important to be very careful to kind of make sure that I'm comparing between, the sort of treated and control groups that they're looking relatively similar so that, you know, the group of children who are growing up in older homes that have this policy where the lead has to get removed from their home are not actually that different from children in other states that aren't passing this policy.
A really good point. And I guess, Margie, maybe you can start us off on this one. Question for, I think, for all of you. With essentially what role, and I know you each touched on it, does public policies play in addressing the challenges that you're studying? And what challenges do you think could have the most significant impact on improving outcomes for low-income families?
Well, poverty is a major cause of the issues we've been talking about. And so greater income supports would help a great deal I believe, and research is showing that in various ways. Second, only 1 in 4 households in this nation that qualifies for subsidized housing actually gets it. Mm-hmm. And so it's totally inadequate housing assistance in this country. And so if we had a lot better with that, more housing vouchers, more kinds of housing with deep subsidies, more than LIHTC, it would help. But is that feasible? Not right now.
If I can, I'll add on to sort of the nutrition food side of that. And yes, I agree with all of this. Federally, we can expand our food assistance programs. We can make them more generous and, increase the income threshold on them. However, I also think at the state level, there is a lot that we can do regarding food assistance. And we maybe with our leadership and in coming years leadership can do that. A lot of what we heard about is in the workforce, right, of caseworkers. This has been a consistent problem. They're underpaid, they're not adequately supported. There's a whole host of reasons why sort of we need improvements in our social services caseworker services in Michigan. I've sort of hit roadblocks in trying to talk to our elected officials and MDHHS about that because there's not resources. But I think it would make a big difference if people could, as I said, trust their caseworkers, know that their caseworkers were trying to get every service possible for them and had a good experience. We hear a lot of sort of hit or miss experiences with MDHHS caseworkers.
I could add also that there's lots of fine-grained ways to intervene in public policy. Just for example, how many of the judges hearing eviction cases actually know that a project is LIHTC and that it is governed by just cause requirements? Do they know anything about LIHTC? Do they know anything about just cause? And that's definitely an area which could lead to fewer eventual evictions, we think, but we don't know.
I can talk a little bit about in kind of the field of lead remediation and kind of prevention of lead exposure. So the Biden administration had taken a lot of positive steps. They came out with a proposed regulation through EPA to basically remove all leaded water pipes connecting to homes in the US, which again is about 10, 13 million homes in the US. And there's a lot of pushback from kind of more conservative states that were kind of worried about the cost to homeowners, landlords, things like that. Obviously, now is not a very good federal environment for any of this to get done. Although RFK, it does seem like maybe this is something that he cares about a little bit more than some other issues. But um, it seems like getting some funding, some federal funding to help do some of this work would probably be more effective, and it would have very high returns benefits for the cost of the project.
Thank you. We are at time. I just want to say thank you so much to the three of you for joining us today. And thank you again to the HSHE team for just this session. And thank you to our listeners who are joined us today. The session is being recorded and will be made available later this week. So thank you again, and hope to see you all soon at our next event.